I used to self-harm quite a lot. I don't want to go there again. I'm feeling really depressed. I'm just worried I'm going to lose it.
Being a teenager is very iffy. People are always pressuring you into doing things that you don't feel very comfortable with. Your emotions start coming through, you're physically changing, your body's developing. I think texting helps us to have confidence in things that we may not be able to say, like in the open.
The smartphone generation will become increasingly vulnerable and increasingly isolated if we as healthcare providers can't give them age-appropriate access to healthcare.
ChatHealth is a messaging service which allows young people to text their school nurse with any health issues that they've got.
It's a web-based message management system. It means all our messages are in one place, everything's auditable. We feel that it's the safest way to provide a messaging service to service users.
We have a triage system where the text comes in, we then read it, and if we can help the young person at that level, we'll help them there and then. If needs be for a face-to-face consultation, then we'll refer the messages onto their named school nurse.
They feel much more comfortable or confident talking, particularly about sensitive issues, from behind, they call it behind the screen, you know, behind the screen of their mobile phone. I think it just gives them that distance or that perceived safety, I suppose, to be really honest. By embracing anonymity, I think we've enabled lots more young people to come forward and talk to us about things that they might not normally be comfortable talking about.
We'd like do a group chat, and these guys can all talk to each other about all this. So
We see a lot of emotional health. We also have a lot of self-harm, young people that text us with self-harm, and again we're able to support them.
People less embarrassed, they're able to open up more, they're able to open up to things that they didn't want to say before.
At any given time, we've got one nurse supporting 65,000 11 to 19-year-olds across Leicestershire, which we think is really good use of resources. So in these days where we're quite stretched to capacity and we've got to think more innovatively in order to make sure we're reaching as many young people as possible, it kind of stacks up pretty well.